Imagine waking up in a hospital, strapped to more machines than you can count. Your doctors walking in periodically to make sure you're still alive. You are fully dependent on a machine to breathe, eat, and live. You cannot even get up to use the restroom. Instead, a nurse rolls you over and changes your diaper. Your body is in constant pain, and the medications they are giving you are only making it worse. The good memories you desperately hold on to are slowly fading, and your sense of time goes with it. You are told that you have a disease with no cure, and it is only a matter of time before you go. Your loved ones have said their goodbyes, and your funeral has already been planned. You have come to terms with this inevitable ending and are ready for whatever the afterlife has in store for you. However, this suffering can go on for weeks, or maybe even months. Should I have the decision to die on my own terms? To end this suffering? The problem is that in this scenario, I would have no other choice but to wait out my death. I have no choice but to endure the weeks and months of pain before my unknown disease kills whatever is left of me. However, a decision called physician assisted suicide, or PAS, has been a viable option for some patients. This option, popularly dubbed death with dignity, is a humane way to die without suffering. I believe this option should be legal for terminally ill patients only. Although there are many people that have religious or moral beliefs that suicide is not right, I ask that you keep an open mind and consider my reasons on why it should be legal. First, what exactly is physician-assisted suicide? Well, according to medicinenet.org, physician-assisted suicide means the voluntary termination of one's own life by administration of a lethal substance with direct or indirect assistance of a physician. In the state of Oregon, where physician-assisted suicide is already legal, the Death with Dignity Act is a prime example for the rest of the world. Legalization of PAS around the world should mirror these laws, as Oregon has seen great success in administration of these drugs. In a 2016 survey conducted by the Public Health Division of Oregon Health Authorities, 133 of the 206 prescribed patients actually took the drug. The median age for patients were 73 years old, with 80% of the patients having some kind of cancer. According to the Death with Dignity laws, a physician may prescribe one of two barbiturates, Seconal or Nembutal. In order to receive these drugs, a patient must meet a number of criteria. The patient must be 18 years old and have a terminal illness that will lead to death within 6 months. Then, a physician must take 2 oral requests 15 days apart from each other. Furthermore, they must receive a written request from the patient and meet with an additional physician to confirm the prognosis and diagnosis. Both physicians must determine if the patient is competent and does not suffer from any psychological disorder. These lethal drugs are taken orally and will cause the patient to slip into a coma within 5 minutes. Death comes within half an hour and up to 48 hours. A healthcare professional is usually present and determines the time of death. I believe that these strict prerequisites to attain the drugs are necessary and will counter the abuse of these barbiturates. On the contrary, states where PAS is not legal, terminally ill patients will still seek the same outcome but use alternate methods of suicide because they have no other choice. For example, Harry, a resident of California, was diagnosed with multiple myeloma, a cancer of the bone marrow. In the state of California, PAS is illegal, and Harry could not bear the pain any longer. Because it was illegal, he did not want his family members anywhere near him during his death, due to the risk that they would be held responsible. So, on January 30th, Harry committed suicide through a method called helium hood, and left a note explaining why, and how no one assisted him. Having laws that can regulate PAS would not only allow terminally ill patients a comforting way out, but it would also allow the government to be the overseer of administrations and regulations of these drugs. It is sad to see someone who is suffering and cannot choose a remedy for their situation. How is it that our pets who are in the same situation can be put to rest, but in most of the world, humans cannot? There are many successful cases of PAS where the patient was spared the cruel and unusual suffering the disease brought forth. One of the most famous cases, Brittany Maynard, ended her own life through PAS at 29 years old. She was diagnosed with stage 4 brain cancer and was told she only had 6 more months to live. Maynard and her family moved from California to Oregon in order to die on her own terms. She tells us in a Facebook post, quote, "Goodbye to all my dear friends and family that I love. Today is the day I have chosen to pass with dignity in the face of my terminal illness. This terrible brain cancer that has taken so much from me, but would have taken so much more." She originally planned to die on November 1st. However, the symptoms grew faster than expected. Near the end, Maynard suffered from frequent seizures, neck pain, and stroke-like symptoms. Why would we let any human go through unnecessary suffering? A spokesman for Maynard tells us that she died as she intended, peacefully in her bedroom, in the arms of her loved one. This is the way I would want to go out if the other option is being hooked up to a machine in the hospital, to die with support, and live out my last days with loved ones, friends, and family. In Maslow's hierarchy of needs, patients are motivated to choose PAS because they do not fulfill the bottom 2 tiers. According to Maslow, a person is motivated to fulfill the tiers of needs on the lower hierarchy before they try to fulfill any tiers above. In this case, the basic physiological needs is not met, which includes the need for oxygen, food, and water. In most cases of PAS, a candidate is so ill that they cannot fulfill this basic need by themselves. They rely on machines and other people to help them fulfill this need. Their pain is so unbearable before an imminent death that they choose PAS in order to relieve themselves of this suffering. This brings me to the next unmet tier, safety. The next tier includes financial security, freedom from war, but most importantly, health. A terminally ill patient is definitely not someone I would call healthy. Failure to meet these 2 tiers on Maslow's hierarchy of needs can motivate a person to choose PAS as a valid option. In conclusion, suffering can be avoided with PAS. Physician-assisted suicide should be legalized and is the solution to the problem. We cannot imagine the feelings and pain these patients feel until it happens to us or a close family member. Mercy is something we give these patients, and a feeling of control when they leave this world.